morning, this is Dr. Prakash Babu, Consultant Urologist, Manipal Hospital Whitefield. I am going to talk another commonest urological condition that we see in the day-to-day life, that is kidney stones. If the body produces more waste, that will precipitate, and the kidney produces enough urine, that will produce as crystals, which will grow and form renal stones. There are 4 types of renal stone that we commonly see. The one is most commonly seen calcium oxalate stones, which will be seen in mainly the persons who are taking medications such as calcium, supplementation of calcium tablets, vitamin D, and vegetables which contain high oxalate content. Next, other common type of stone is struvite stones or infection stones, most commonly seen in patients with urinary tract infection. They will grow very rapidly and causes minimal symptoms. Another type of stone which we see commonly, uric acid stones. Uric acid stones most commonly seen in the patients who are on high protein diet, diabetes, and chronic diarrhea patients. And another rare variety of stone what we see is cystine stones, usually seen in metabolic conditions such as cystinuria. This is very rare type of stone. Usually the patient will have flank pain or backache, vomiting, they pass blood in the urine, and sometimes they develop fever. The patients who take less amount of liquids, oral fluids, again obesity, again patients who are on supplementation of calcium tablets, vitamin D, and who are on high protein diet and who takes more salt. These are all the patients, they are more prone for kidney stone formation. So there are various tests that can detect kidney stones. Simple ultrasound abdominal pelvis, which will give the stones in the kidneys and how parenchyma of the kidney and amount of hydronephrosis. Some blood tests are there: serum creatinine, serum calcium, serum uric acid, serum oxalate, and various other tests. And next, the important investigation which will give a lot of information about the kidney stones are plain CT KUB, which will give number of stones, size of the stones, density of the stones. So according to this, we can classify the patients into various modalities. They are divided into medical wait and watchful, medical treatment, and surgical treatment. If the stones are very small, we can just wait and watch. Usually these stones will pass into the urine on their own. If the stones are quite large, if they are growing, if they are blocking the urinary passage, yes, these are the patients we can subject for surgical intervention. Sometimes, if the stones are small, we can give certain medications such as alpha blocker, tamsulosin, which will help in passage of the stone. Sometimes, if the stones are uric acid stones, patient requires allopurinol, which will decrease the serum uric acid level and prevents the stone formation. And sometimes if the stones are infective stones, we can give antibiotics to prevent the recurrence of the stones. We have various surgical modalities to treat the kidney stones. The non-invasive modality is ESWL, called extracorporeal shockwave lithotripsy, which can be utilized by the patients for small stones till 1.5 centimeter stones in the kidneys, where patient do not require any hospitalization, do not require any anesthesia, and here the procedure mainly requires this equipment send sound waves and break the stones so that the stones comes in the urine. The next modality is RIRS. RIRS means retrograde intrarenal surgery. This is the latest technology where there is no cutting on the kidney. Instrument can be passed through the urinary natural passage, and with the laser technology we can break the stones and all the fragments will come out in the urine. Another latest technology called mini PCML. Here there is very small incision, half an inch incision on the back where the kidneys are situated. Then you can enter into the kidney and break the stones with laser technology. So we at Manipal Hospital Whitefield, we have laser technology to treat the kidney stones.